absolute contraindications. Remember, these are the ones, don't even think about it, please. Okay, you really don't want to mess anyone up. Some of these are, can be pretty obvious, but they are worth mentioning. Again, I talked about the broken bones. You don't want to massage over something that is acutely injured. The second one is being intoxicated. So if a person is intoxicated with alcohol or drugs, their sensory perception is altered. They may not be able to sense pain. They may not be able to react or let you know that something is wrong. So it's best to wait till they're sober to even think about getting a massage, because it can really cause harm to a person who isn't really aware or in the present, even though they're relaxed. Having an infectious skin disease can put the masseuse in danger. You don't want to risk spreading anything. Plus, if there's open sores, that's not good. Shingles, for example, is very painful already, so you don't really want to add to that by manipulating over those lesions. Okay. Again, a blood clot. You don't want to risk massaging an area that could be prone to dislodging a blood clot and moving elsewhere in the body and causing more damage. In an acute heart attack or stroke, you definitely don't want to engage in any massage therapy. And again, first, this is the least of a person's problem, is being able to relax, having a massage. You definitely want to take care of these issues at first, and then do that. Plus, if you happen to be massaging someone who's had a heart attack and it's because of a clot, again, you can further run the risk of dislodging that clot and traveling somewhere else and causing more damage. So just let things kind of simmer down. It's great that you want to have relaxation and whatnot, because relaxation can decrease the heart rate and improve, a cardiovascular status, but you don't want to do it when there's an acute event that's going on. Then we have burns. This is injured, inflamed skin, minor or major. So really just don't deal with that. Don't mess with that. Now, having said that, in a person who sustained burn injury, you basically want to wait until the person is completely healed. And sometimes, especially if it's a significant burn, they can develop a lot of tough scar tissue, which makes the skin more thick and non-pliable and non-movable. So then at this point, a massage would be ideal, but only after the person has healed from it, because you want to help restore some of that elasticity, but definitely not in an acute burn injury. Then we have major surgery. In a major surgery, a person literally does have an acute trauma. It's a controlled trauma, but it is a trauma to the body. So you don't really want to engage in any massage at this point in time. The patient needs to heal. You don't want to disrupt any tissue that's mending and healing, and you want them to be at their best before you want to even consider doing this type of massage. In an open wound, kind of almost the same principle. You don't want to go putting your hands on an open wound. Not only does it cause pain, but you can also introduce infection at that point. So just let it heal, okay? And then same principle with the post-op wound after a person has undergone surgery. If the wound is now stapled or sutured, you don't want to risk causing more pain or even disrupting that suture or staple with manipulation, okay? So just wait till the person is healed up and feeling better before you engage in massage. Then again, acute illness or high fever. When a person has a high fever, basically that's saying that the body is trying to defend itself against something or fight something. And having a massage in an acute illness can actually put the therapist or the masseuse at risk of spreading infection. You may actually make the person feel worse, especially if the body is already weakened. So it's best to avoid an acute illness. And then the last point is actually quite major. Many people love massages, they really do, but actually some don't. And people that are out there who don't like them, some of them don't like to be touched for whatever reason. It makes them more anxious. Or if a person is extremely ticklish, sometimes the person may be laughing, but it's actually causing them pain when they're tickled. And so a massage may not be the best option for a person if they just can't handle it. and it'll make them very uncomfortable. So basically, if the person doesn't want to do it, I put this in the absolute contraindication column. Just don't do it.